guys, welcome. Today we're going to go over our anaesthetic home care guidelines with you and things to look for post your animal having an anaesthetic. Often in our discharges, you'll get a lovely little folder like this with all of the current information and relevant information inside, and a vet will go through that with you at point of discharge. We just want to make this little video to make sure that you've still got it referenced so that you can come back to it. It's a little bit easier than finding paperwork. So first things first, when your dog gets home, because they've been fasted, they're going to be pretty keen about having some food. We often recommend giving them half of their normal dinner size just when you get home. Because they are hungry, they tend to gorge the food and this can make them vomit. Some of the anaesthetics take a little bit longer to wear off as well and can cause them to be feeling a little bit nauseous. So half their normal food when you get home. If they handle that okay and there's no vomiting and you think that they're still a little bit hungry, give it a few hours and you can give them a little bit more before you go to bed that night. Water as per normal, so always access to fresh water for when they're at home. Another key point is thermoregulation. So they have trouble controlling their body temperature post being sedated and having that general anaesthetic. So what we'll often get you to do is keep them inside. We know that's a bit difficult for working dogs and things like that, but even in a laundry or something would be helpful just to make sure that they can maintain their body temperature post having that sedation or anaesthetic. The next part is they may or may not develop a cough. That is quite often more for our animals that have had a general anaesthetic. We place an ET tube down the throat. Sometimes that can annoy the throat a little bit and they'll go on to develop a cough. We often say that if the cough develops and it's lingering or it's getting worse, then that's definitely a point of call for us so that we can chat to you over the phone about where we go to next. Other things you may notice post your animal having a sedation or anaesthetic with us is clipped patches of fur, often from where we've placed the IV catheter, or a clip patch of fur on the neck from where we've taken their blood for the day. That will grow back over the next few weeks. That hair will return to normal. But essentially, apart from your pet being drowsy kind of for the next 24, 48 hours, just keeping an eye on them, referring back to your notes, or if you're in doubt, please just give us a call and we'll go from there. This one's going to be going over soft tissue home care. This point of call is exercise restriction. So after your pet has had surgery, so primarily talking desexing surgery for cats and dogs, both male and female, we want them to rest so that they've got time to recuperate. Up to 10 days is that resting period. So that includes no running, no jumping, no being silly buggers with other animals in the house. And what that often means is if your pet is a puppy, which they often are at point of desexing, even crating them when no one is at home. No jumping up on couches or bedding or anything like that either. Lead walks to go outside to the toilet and then to come back inside. In terms of stitches, for most of our desexing procedures, your pet will have what we call intradermal stitches. So they're on the inside of the skin. So you won't be able to see them from the outside. If your pet is fair-skinned or has white patches on their belly, you might notice a little bit of purple coming through. That's the color of the stitch material. For wounds and lacerations and things like that, we'll often have stitches on the outside, or even in fact sometimes some staples. Or at discharge, your vet will give you instructions as to when they need to come out. Most of the time stitches stay in for 14 days, whereas staples stay in for 10. Wound care is vitally important, so it's not uncommon for the wound to be oozy for the next 12 to 24 hours. That's quite normal. We do ask that you look out for any bleeding that seems to be a little bit more than an ooze, or if you're concerned, to definitely give us a call. Please pay attention to the wound and check it at least once or twice a day. You can dab around the wound, but we never want you to touch it directly. Just a warm face washer or washcloth is great for getting that little bit of ooze off around the wound. We also have a few pinpoints that we get you to call us on if you are worried, and they're located right at the bottom here. So there any excessive or redness or irritation around the suture line, any dull or listless behaviour, especially after the first 24 hours, or any vomiting or refusal to eat, we definitely need you to be bringing your pet back in. A couple of other pointers for you: no swimming for the next 14 days post-surgery. So definitely don't want them going near water. That will delay wound healing. And your dog may also go home with an e-collar, so a pretty little satellite dish for them to keep on to make sure that they're not going to itch and scratch and lick at the wound. So they have really rough tongues. Any licking at the wound will undo all of the stitches. As per normal, if you're worried about anything that has happened with your pet or any of their wound care, please just give us a call and we'll talk to you through it over the phone.